Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Here in the show, we have Genevieve Silva and Cassandra Thiel. Genevieve is a medical student. Cassandra is an assistant professor at NYU's Langone Health's Departments of Population Health and Ophthalmology. Together, they wrote the KevinMD article, "Is COVID a Turning Point for Sustainability in Hospital Supply Chains?" Genevieve and Cassandra, welcome to the show.
Thanks for having us.
So we'll get into your article in a little bit, but I'm going to ask each of you for your stories and journeys to where you are today. Genevieve, why don't you go first?
So I'm currently a third-year medical student at the University of Pennsylvania, but my journey towards being really interested in climate and health began pretty much from the beginning of undergrad, in which I started getting involved in my school's program on climate change communication. I interned at an environmental advocacy organization, and I completed my senior thesis work around environmental justice implications of fracking fluid. And throughout that journey, I became really, really aware of the intersections between climate change and environmental impacts and human health. And as that paralleled my interest in medicine, and I matriculated to the University of Pennsylvania School of Medicine, I got really, really involved with healthcare sustainability groups on campus and a national group called Medical Students for a Sustainable Future. This group led me to Dr. Thiel's lab. I was drawn to because she was working directly at the intersection of how the healthcare field itself contributes to emissions and waste and how it can become more sustainable. And when the COVID pandemic hit, it was right around my summer when I was looking for a research internship, and that really brought us both together and got us thinking about the intersection of healthcare sustainability and also the COVID pandemic, which led to the article that we wrote together.
And Genevieve, has climate change been incorporated in any way during your formal medical training?
While we haven't necessarily had a formal course around climate change, it's something that some of my classmates and I have really been working towards, and we've had some very productive conversations with administration around looking for ways to incorporate connections in our subspecialty blocks and in some of our social determinants of health courses, and ways that we can link climate to health. And the administration has been largely receptive, so that's something that we're hoping will improve in the future.
And Cassandra, can you briefly share your story and journey to where you are today?
Sure. My background is actually in civil engineering, civil and environmental engineering. And while I was a doctoral student at the University of Pittsburgh, I met a surgeon who was very concerned about how much garbage she was making. And this got me started on a journey looking into healthcare and resource utilization and the environmental footprint from our healthcare services. So my lab at NYU Langone Health is really focused on using these engineering tools to quantify emissions from healthcare services. So a lot of these studies we do are baseline assessments of like the carbon footprint from providing a specific surgery. And Jenny joined my lab one summer ago, so 2020. And of course, we were in the middle of the COVID pandemic. And here in New York, we had a really large outbreak going on. And it was, of course, a little scary. And we had lots of PPE shortages, and every hospital was kind of, on their own trying to figure out where they could source these single-use supplies from. And this intersects, of course, with sustainability quite a bit because those single-use supplies have a really large environmental footprint. So we started talking more about resilience and these supply chain issues, and started thinking about all the ways that the COVID pandemic would probably reshape our hospital supply chains and how we can start incorporating sustainability into that as those changes were occurring.
Now, before I ask Jenny to go into the article, give us a sense of the scope, because I really honestly didn't really think about it before I read your article. Give us a sense of the scope of the carbon footprints of our healthcare system.
Yeah, so nationally, the U.S. healthcare sector is responsible for between 8 to 10% of our carbon footprint. So it depends on the estimates and the assumptions that they're making. But that's all healthcare activities. So pharmaceutical production, hospital care, the transportation associated with moving patients around and those kinds of things. It's a lot, but that That's nearly 10% of our greenhouse gas emissions is a huge number because we emit a lot of greenhouse gases in the US. So if healthcare in the US were a country, it'd be the 13th largest emitter in the world, ahead of many other countries. So there's a lot of work that we can do as healthcare professionals to mitigate our impact, which should then also improve health outcomes for our patients and just people all over the world.
And we'll certainly talk more about that in the interview. And both of you wrote the KevinMD article, Is COVID a Turning Point for Sustainability in Hospital Supply Chains? Genevieve, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story about why you, Cassandra, decided to write it?
So, as was just being said, the healthcare system in the US contributes a significant amount of the country's greenhouse gas emissions. And a recent study actually found that 64% of those emissions from the US healthcare system come from the supply chain itself. And that includes production, transport, disposal of goods and services. And as Dr. Thiel and I were thinking about putting together this article, we realized that as the COVID pandemic has escalated, the utilization of resources and waste and supply chain disturbances has really escalated as well. So the point of this article was really to think about how we can harness this energy and momentum that currently exists in the healthcare system around rethinking supply chains, now that we've seen how easily they can be disrupted by disasters like the COVID pandemic, and how that momentum can be utilized towards also making changes in supply chain that will make it more environmentally sustainable moving forward, to kind of achieve a dual aim of both reducing healthcare's greenhouse gas emissions and also making its supply chain more robust to future disturbances, like God forbid a future pandemic or whatever else may pose a threat to the supply chain. So in this article, to address that question, we go through a few different ways in which supply chains are currently being updated and ways that they could be further updated with tweaks to make them more sustainable. We talk about consolidating production to be more local, giving examples of certain healthcare systems that did in-house production of COVID tests, for example, when COVID testing was otherwise unavailable, when resources were strained. While this was helpful during the COVID pandemic, it would also be helpful long term in terms of reducing emissions from transporting supplies to create resources long term after the COVID pandemic has passed. We also spoke about making procurement more sustainable. There are multiple resources that exist from organizations like Practice Green Health that list suppliers that utilize more environmentally sustainable practices than others. And hospitals during the COVID pandemic began vetting vendors for various reasons. And that kind of practice can be translated into also vetting vendors for their environmental sustainability. In addition, we spoke about supply sharing amongst healthcare systems, which was previously not so much standard practice, but was also increased during the pandemic, which can also, again, help reduce costs and greenhouse gas emissions associated with bringing in supplies from afar. And finally, we wrapped up the article by talking about how we can just overall work to reduce need for instant supply chain ramping up by creating a system that overall just emphasizes reuse of supplies more than generation of new supplies. Third-party reprocessing is a method by which we can do this, as well as increasing technology around demand forecasting and automation of tracking inventory in hospitals.
And Cassandra, when I hear about hospital supply chains, it's several steps removed from what I see as a physician. So can you share like a story or a case study to make a hospital supply chain more tangible to the clinicians?
There are so many supplies that we rely on to provide care, and we don't think about it because they're usually there and available for us. So, if I'm going into, let's say, a cataract surgery, I've done a lot of work in ophthalmology. we have the PPE, our gowns and gloves and masks and head caps and all of those kinds of things. Those are usually all single-use and disposable. And then we have our surgical supplies. So, cannulas and I don't know. There's even disposable blood pressure cuffs and stethoscopes, right? So all of these single-use supplies come in. We have, of course, reusable supplies, which also have to be manufactured somewhere, but then are typically sterilized in-house in our central sterile departments, which are fun places to check out for anyone who hasn't seen them. All of these supplies have to be manufactured somewhere. Usually they're manufactured all over the world. Gloves, of course, we know a large number of them came from China, which is part of the reason we had shortages, that their manufacturing was shut down as the initial outbreaks occurred. And they're sent all over the world, really huge global supply chains. And we use them, hopefully, once. And then they get thrown away, and their disposal makes them end up in our communities in various ways. Usually for the US, it's landfilling or incineration, but all of these steps and stages have emissions. We're burning fossil fuels to get these goods manufactured and transported wherever they're going. And in addition, because they're manufactured brand new every single time, that puts us a little bit at risk, especially when we suddenly need a lot of, say, PPE, and they're hard to source. And we need more than we ever have in the past, right? So you have both a supply and a demand issue, which I think most clinicians would have felt last year, especially, that shortage of PPE was really tangible. And it's something that just a few months before the COVID pandemic, I could go into an operating room and grab as many gloves as I wanted, and no one cared. And then all of a sudden they were under lock and key. And, it's just all the supplies are very crucial. And it's something that, because it had worked in the past, we didn't have to think about it. And our concern moving forward is that with climate change, there will be a lot more disruptions to supply chains. We saw it with Hurricane Maria hitting Puerto Rico, that interrupted supply of IV bags. These kinds of things will become more and more common. So we really have to rethink how we're using these resources and where we're sourcing them from.
And Cassandra, I work for a community hospital in a relatively small town. Now, due to solutions to these issues, does it have to be at a policy level, or are there things that individual hospitals can do?
I think it's a little bit of both. Of course, we would love to see regional or national policies that help us maybe stockpile gear and manage those stockpiles well. But I think local hospitals also have a role to play, perhaps with your group purchasing organizations if you're contracting with a GPO. But you can certainly work on your procurement and the contracts that you have worked out with suppliers. You can start looking for more reusable goods, for example, because then you own those products. So there are reusable isolation gowns, for example, and you could have your own stock of those and set up ways to sterilize and clean them. And that typically has a lower environmental footprint than buying brand new and disposing of them over and over again. But also, as Jenny mentioned in our article, just having better track of your inventory can be very helpful, right? So that the supplies don't expire and have to be disposed of without having been used. And even before expiration, there's a lot of supplies, particularly in operating rooms, even inpatient units, where we end up throwing the supplies away because of some weird issue. Maybe they were opened up and not used, but the patient was in the room, or maybe they fell on the floor because we overstocked a cabinet. Like those kinds of things are definitely something that you can work on the local level to just reduce what you're bringing into those spaces.
We're talking to Genevieve Silva and Cassandra Thiel. Genevieve is a medical student. Cassandra is an assistant professor at NYU Langone's Health Departments of Population Health and Ophthalmology. Together, they wrote the article, "Is COVID a Turning Point for Sustainability in Hospital Supply Chains?" Genevieve, what are some things that medical students and physicians can do on an individual basis to bring more attention to that intersection between climate change and healthcare?
I think that part of what both med students and physicians can do is just bring the conversation more to general awareness of their colleagues in healthcare systems. I think it's something that's not thought about as often as it could be. And, just making your colleagues aware whether there's an opportunity to speak at a conference, or to share an article about the amount of waste that's being generated daily by hospitals, because it's very significant. That can just really get it in the backs of people's minds and make someone maybe think twice before opening up a second kit just to check what's in it, and then having to throw it away just because it's been open, even though it's unused. Things like that happen so frequently in the hospital, and are just, as Dr. Thiel was saying, easy ways to avoid waste. And I'll also say that there's a lot of really great toolkits out there by organizations like the Medical Society Consortium on Climate and Health, and Practice Green Health, Healthcare Without Harm. These are all organizations that have published resources for physicians and med students to use for both advocacy and education, that include information to use in patient conversations, as well as things like slide decks to use in presentations to colleagues. So there's a lot of ways you can get involved, and I definitely encourage anyone who's interested to get involved.
And I'm going to ask each of you your take-home messages to the KevinMD audience. Cassandra, why don't you start with you?
Yeah, I think my take-home message is, it's very clear after the COVID pandemic that the healthcare supply chain needs work. We're not resilient, it's not sustainable, and now that we're kind of not fully recovered from COVID, but able to step back and reassess things, now's the time to really work on the supply chains and make them more sustainable, make them more resilient.
And Genevieve, what's your take-home message that you want to leave with the KevinMD audience?
I would echo what Dr. Thiel said. I think the supply chain disruptions that we saw from the COVID pandemic really illustrate how important it is to be preemptive and proactive with anticipating threats to the healthcare system. And climate change is posed to create so many escalating threats over the next few decades that now is really the time to take action to bolster healthcare supply chains, both in terms of resilience and also in terms of not contributing to escalating climate change by making it more environmentally sustainable.
Genevieve and Cassandra, thank you so much for sharing your time and insight, and thanks again for being on the show.
Thank you for having us.